Well, hello and welcome everyone to Wellspring Healthcare's second webinar. Today, we're going to be talking about breast cancer awareness, and this is a really important for women in particular because breast cancer is a very highly prevalent disease within their sex, and so I think it's very important that we start to discuss when we should start screening, when we should stop screening, and all different types of factors in between. So without further ado, let's go ahead and get started. Now, but before we get started, I always like to discuss our disclaimer. Now, of course, this presentation is intended for information and educational purposes only. And while I am a licensed physician, I am certainly not acting in the capacity of a physician for this presentation. I am not your physician, and this should not be construed as medical advice, diagnosis, or treatment. And always seek the advice of your physician or other qualified health provider with any questions you may have. And certainly never disregard professional medical advice or delay in seeking it because it's something that you may have heard or seen in this presentation. And of course, no patient-doctor relationship is being established through this presentation. Any and all decisions related to medical care should be made in consultation with a licensed medical professional. So again, for some of you that may be new to Wellspring Healthcare, what is Wellspring Healthcare and who are we? So my name is Dr. Brian Haas, and I founded Wellspring Healthcare under the principles of compassion, effective communication, and empowering education in order to transform lives. So that's one of the purposes of doing our webinars, is to reach to a wider audience, to help people that may be struggling with some of these questions, to get some practical application and advice. All right, so let's go ahead and give you some contact information. So Wellspring Healthcare, we have a number of ways to get a hold of us. So if you are a patient at a skilled nursing facility and you would like us to come and take care of you, please don't hesitate to reach out to William, our medical assistant. And of course, if you are a facility, that's either a nursing facility, long-term care facility, assisted living environment, and you're interested in partnering with us and would like us to come and provide care in your building, please don't hesitate to reach out to our Chief Operating Officer, Brandy, and her telephone number is listed on the screen here at 816-708-1658. And of course, you can always follow us on our website at www.wellspringhealthcare.org. All right, well, let's get into breast cancer awareness. Of course, we are in Breast Cancer Awareness Month, which is October. And so I want to talk a little bit about some just very big high-level topics, breast cancer 101. So it is the most common type of cancer that affects women. It happens to be the fourth leading cause of cancer death in the United States. And why do we screen? We screen because it helps us to reduce morbidity and mortality. So very important factors there. Now, how do we detect breast cancer? So women in our audience might recognize this picture over here in this machine. This is a mammography machine, and it helps us by taking X-ray pictures of the breast tissue so that we can identify if there's any abnormalities in that breast tissue. But there are some other modalities of treating and screening for breast cancer, and those include ultrasound, MRIs, and even a digital breast tomosynthesis as well. Although each of those are less common, and we don't do them generally for screening. They're more of a confirmatory test or more of a test that we would use in order to do a biopsy or something of that nature. So when to start and stop screening? So this is a hotly contested situation when we're dealing with these multiple different organizations. So ACOG is the American College of Obstetricians and Gynecologists, the American College of Radiologists, American College of Surgeons, the United States Preventative Services Task Force, and the WHO. So all of these different organizations have different guidelines, recommendations on what they would recommend. And so I think it's extremely important that this is reiterated from the beginning, that this should be a discussion with your individual provider about your unique and individual situation. So we should usually start this discussion of screening at around the age of 40. We should start the discussion about stopping screening around the age of 75. And our screening should occur either yearly or every other year. And that's the general consensus among these different colleges of recommendations. Now, there are some potential harms in screening patients, and that's why these different societies have different recommendations. And one of the, or several of the harms of screening are false positive results. So if a woman is screened and then has a false positive, what a false positive means is that the test or the mammography that they received tells them that they have something that's wrong, but that's something that the radiologist is seeing is incorrect. So it's not actually there. And so that's what we call a false positive. And that can lead to overdiagnosis and treatment, that can lead to further biopsies, that can lead to pain, anxiety, and radiation exposure because you're getting these tests that are happening, and a lot of them require radiation exposure. So, why should this be individualized? Well, first and foremost, we need to determine when we should start screening. So, these colleges vary between starting at the age of 40 and the age of 50. The United States Preventative Task Force Services, they did a great study looking at women, and they found that if you started screening at the age of 40, there were more false positives because you're going to do more screening and you're going to have more screening tests. And so that's going to lead to more unnecessary biopsies and more overdiagnosed cases. And they found that they only found 8 fewer deaths per 1,000 patient years. So that's not a lot in the grand scheme of things. Now, when we started screening at the age of 50, they found that they only captured 7 fewer deaths, but they had less false positives, less biopsies, and less overdiagnosed cases. And this makes sense because we started screening 10 years later. So, a woman, for instance, that started screening at 40 would have 10 more years or 10 extra years of screening that a woman at the age of 50 would not have. So that's why it would lead to potentially, less false positives and less biopsies. But now an individualized care plan needs to be considered. Um, and I think that that's very important because each woman needs to weigh those risks and those benefits. And there might be women out there that say, breast cancer runs in my family and it is a significant concern for me. And so by not screening until the age of 50, that might induce more anxiety, pain, discomfort, all of those types of things. And so a woman in that situation very much may want to proceed with screening sooner rather than later. So that's why it's a very individualized treatment choice. So there are a few general consensuses out there. The first is that women aged 50 to 74 years should have screening at a minimum of every 2 years, and some women should have screening every year. Now, this is another interesting one that I find, but it is a general consensus. Women over the age of 75 with a life expectancy of 10 years or less should stop screening. Okay, we're going to talk more about that in just a minute. The third thing here that's a general consensus is that clinical breast exam should not be used to screen for breast cancer. So what is clinical breast exam? That's where your clinician does a breast exam where they go up and down over the breast looking to see if they feel any nodularity or abnormalities. That has not really been shown to meaningfully impact morbidity and mortality. All right, so let's talk a little bit more about this life expectancy thing because I find this really challenging in order to say that someone has a life expectancy of 10 years or less. That's such a long time. A decade is a huge length of time. So, in preparing for this talk in particular, I actually was looking at ways to try and predict this. And we have calculators that we use in medicine, like the Framingham cardiovascular risk calculator and things of that nature. But I came across the Social Security Administration actuarial website, and I was able to put in a date of birth of today, October 18th of 1945, and that came out to giving a woman age 75 having a life expectancy of 13.7 more years. That's the expected. Now, the thing that I find so interesting about this is that these are actuarial tables. So these are people that just look at statistical data and they say that someone that's 75 typically lives 13.7 more years. But now that doesn't take into consideration any of their health care, right? Doesn't take into consideration whether they're a healthy 75-year-old or if they're an unhealthy 75-year-old. Doesn't take into consideration if they're a sedentary 75-year-old or a non-sedentary 75-year-old. So I struggle a little bit with this recommendation over here that women over age 75 with a life expectancy of 10 years or less should stop screening. Well, according to the Social Security Administration, a woman over 75 years or 75 years today would have a life expectancy of 13.7 years without knowing anything else about them. So again, I struggle with this, and we have to really take this into consideration. But again, this is why this needs to be something that's discussed. Now, I think more so than just life expectancy, we need to have this open discussion about why we would do this, because breast cancer is common, becomes more common as we age. Screening helps us to detect this breast cancer. And when to start and stop screening needs to be an open discussion with your physician. But in addition to that, we need to also determine whether or not the risks and the benefits are there for us. So please keep in touch with us. Feel free to call our medical assistant, William. Please reach out to Brandy, our chief operating officer, and certainly follow along with us at Wellspring Healthcare. So we certainly look forward to you. And certainly if you've had any comments, let's go ahead and check the chat here and see if we have any anyone in the chat. Doesn't look like any chat comments or any questions, but now would be a great time to go ahead and leave your questions for us if you have any questions. So otherwise, we thank you for attending, and we hope that this is giving you a little information in regards to breast cancer screening, and more importantly, when to stop screening, because I think that becomes a topic of concern, because, some women will get to the point where they've reached 75, 77, maybe they're 72, and they've decided, I wouldn't want any further treatment to be done regardless if something was found or not. So I think it's really important to maybe take those into consideration. So again, appreciate your time, and we look forward to seeing you again at our next webinar, which will occur on November 1st. And we're going to be devoting attention to our male population, where we talk about prostate cancer. So look forward to meeting you all at the next webinar. Thank you so much. Take care.